Hi, I'm Sarah Livingston. I'm the Director for Crisis Services. Redwood Community Crisis Services respond to the lifespan in the community. So if somebody is having a mental health emergency and they feel that maybe they need to be seen immediately, they're at risk of suicide or hurting somebody else or can't take care of themselves because of their mental health, we're going to respond. We'll see them at the hospitals. We respond to all 3 hospitals within the community, and we also respond to our 2 offices, one in Ukiah and the other one in Fort Bragg. We respond to the hospitals 24 hours a day, 7 days a week, so there's no time that we wouldn't be able to help somebody out if they were having a tough time. We also staff a crisis hotline 24 hours a day, 7 days a week. As far as the populations of folks that we see, it's across the lifespan, like I said, and the services are that initial crisis intervention and then the 60 days of follow-up. If somebody has Mendocino County Medi-Cal, we're absolutely going to provide them the 60 days of aftercare services if that's what they are wanting, because it is something that they can choose to do. We don't force anybody to do aftercare, and if they want it, those services include individual rehab, individual therapy. They can also include family therapy and case management. What happens is that when people are afraid to reach out, then they continue to not do well. And unfortunately, within our society, oftentimes when people are having a mental health crisis, we tell them, suck it up, get over it, you'll be okay. It's not as bad as you think. It's really all right. Oh, you're keeping your social distance? That's fine. That's what you need to do. But then we forget that there are people that are really impacted by that. So when people are isolated, we are social creatures. Oftentimes people struggle. If they're struggling, there is hope. And hope is simply in that simple word of asking for help. And we're available. We've seen an increase over the last year of suicides. So, if you see somebody struggling, reach out. You're going to see in this broadcast the National Suicide Helpline. You're going to see our crisis hotline and, of course, also the texting hotline. So, if it's too hard to talk about, text it. I think when we talk about isolation, it's important to remember that people are stuck within their own thoughts. And what does that mean? That means they're afraid to ask, or does it mean that there's such a stigma within their culture that if they ask, they're a failure? Not a failure. You'll be surprised how many people have thoughts of self-harm or suicide. Having that thought does not necessarily mean that action. However, if that thought sits and it festers and there is no help, it can certainly grow. By asking somebody how they're doing, you're not making them have this thought of self-harm or suicide. What you're doing is reaching out and letting them know that there is help and there is hope. A lot of folks feel that they're alone in this world. They're despondent. There's nobody that will help. And oftentimes, when people see a mental health professional, what they quickly find out is that there are people that care. They find out that individual, the therapist, or the crisis worker, they care. But as they sit and they work through that crisis, they soon find out that their family members care deeply. And the loss of that individual is significant.